Hello and welcome. I am pleased to welcome our friends from the University of Guelph who will be sharing their findings related to dairy health research. Doctors from the University of Guelph received funding from the Ontario Research Fund and the Dairy Farmers of Ontario to complete a project on a variety of topics related to dairy cow and calf health, disease, and management. Part of their goal with these projects is to share what they have learned with different groups that are or will be involved in the dairy industry. This includes dairy farmers, dairy industry, veterinarians, and also the youth that may one day work in the dairy industry. Today, we welcome Allison Welk and Kristen Edwards to discuss two of the topics explored under the project titled Antimicrobial Stewardship Solutions for a Sustainable Ontario Dairy Industry. For Ontario's dairy sector, solutions start on the farm with sound science-based approaches. The objective of their research is to improve responsible use of antimicrobials in the dairy industry. Their research targets the 5 R's of antimicrobial stewardship: responsibility, reduction, refinement, replacement, and review, with the goal to collaborate with partners in the dairy sector to minimize the impact of AMR and to ensure that antimicrobials will continue to be an effective tool in protecting the health of Canadians. Allison Welk grew up on a pig farm in eastern Ontario where she developed a deep appreciation for livestock care and agricultural practices. As a PhD candidate in epidemiology at the Department of Population Medicine, Allison's research explores how automated technology can identify early behavioral indicators of neonatal diarrhea in dairy calves, aiming to support earlier intervention and better health outcomes. The aim of this work is to improve calf welfare and help farmers make more informed treatment decisions. Allison will be leading a presentation titled From Alert to Action: Intervention Strategies for Calf Diarrhea Based on Automated Disease Alerts. This presentation explores 2 studies that evaluated the effectiveness of timely therapeutic interventions for neonatal calf diarrhea using disease alert systems generated by automated milk feeders. The first study assessed the impact of administering non-steroidal anti-inflammatory drugs when an alert was triggered, while the second study investigated whether colostrum supplementation at the time of an alert could enhance recovery from diarrhea. Kristen Edwards earned her Doctor of Veterinary Medicine degree from the Ontario Veterinary College in 2014. She began her career at Perry Veterinary Clinic, a large dairy practice in New York, before returning to Ontario in 2016 to practice dairy production medicine with Tavistock veterinarians. She remained there until April of this year when she joined the Ontario Veterinary College as a faculty member in ruminant health management. Kristen's research focuses on factors influencing the success of pre-weaning and peri-weaning periods in Holstein dairy calves. She will be sharing the evaluation of bovine colostrum replacer supplement to improve the weaning transition in Holstein dairy calves. The objectives of this randomized controlled trial was to evaluate the efficacy of supplementing bovine colostrum replacer during weaning to reduce intestinal permeability, aka leaky gut, and improve weight gain. Please use the comment section on this Facebook Live to ask your questions, and Allison and Kristen will answer them following each of their presentations. I'm first going to toss it over to Allison, who will start first by giving her presentation.
Perfect. All right. Well, thank you, Laura, for that introduction. As Laura mentioned, I'll be giving a presentation basically looking at how we can use automated technology to detect disease and provide different treatment strategies for neonatal calf diarrhea. So as many of you guys know, calf diarrhea still is quite a serious problem in the dairy industry. Some recent studies have found have seen or observed high incident rates of diarrhea, up to 80 to 98% calves getting diarrhea on farms. And we also find that antimicrobials are still a common treatment for diarrhea. And this is despite the fact that a lot of cases are more viral or parasitic. So overall, there is still a need for early disease detection and treatment strategies for this disease. And in particular, this can be quite challenging for very young calves as well as grouped house calves when they have diarrhea. Surveys talking to farmers have shown that they find it challenging to detect diarrhea, especially in group house settings. So one way we can sort of look at detecting diarrhea is looking at behavioral changes due to sickness. So when animals get sick, they often display sickness behaviors, and these behaviors typically start before animals start showing clinical signs of disease. And so in dairy calves, some common sickness behaviors are decreased activity, feed intake, suckling strength, social interactions, as well as increased lying time and sleeping. And so I would say over probably the past 5 years, there has been a lot of interest in using automated technology to detect changes in sickness behaviors in order to detect the onset of a lot of diseases. And this is true for diarrhea. And here I just have a little example of this, a graph here. So on the y-axis, we have milk intake, which was collected by automated milk feeders. And then we're looking at comparing their milk intakes of healthy and diarrhea calves. And so as you can see on day 0 of diarrhea, calves with diarrhea had reduced milk intakes. But the day before diarrhea, we can see that milk intake was already starting to decrease. So the idea is, can we detect these changes in these behaviors in order to detect the onset of diarrhea? And so in our lab, we have been working on a diarrhea alert for this, which basically we found that we could detect diarrhea when we saw a 40% or more reduction in milk intake and drinking speed over 2 days. And so the main objective of the 2 studies that I'm going to talk about was really looking at different intervention strategies. So the first one looking at meloxicam, and the second one looking at colostrum supplementation when administered at a diarrhea alert. And we want to see if this would improve the diarrhea severity, growth, milk intakes, and activity of these dairy calves, and see if, basically administrating some sort of therapy at the time of these alerts could help improve the health outcomes of these calves. So I'm going to go into a little bit of our experimental design. The 2 experiments really followed a very similar design other than the treatments. So both studies were done at the Alora Dairy Research Center. And here we house calves in groups of 15, and we followed them every single day from 3 days to 28 days of age. And these calves were fed on automated feeders, and we offered quite high allowances of milk, about 15 liters per day. We also attached activity monitors to each of the calves, so we were able to measure their activity and line behaviors. And then for each calf, we also health scored them, looking at dehydration, attitude scores, as well as fecal scored them every day to know exactly when they got diarrhea and when they recovered. And then we also collected body weights weekly. And so for this study, we did define diarrhea as loose feces for more than 2 days, or watery feces for more than 1 day. So we were also interested in looking at how the farm staff treated these calves, in addition to what we gave them. So all farm staff was blind to the study treatments. So I'm just going to go through slowly our treatment protocol so you guys understand how we treated, the farm staff treated diarrhea on the farm. And so the first thing we do is when we see signs of diarrhea and low milk intake, we provide calf 1 shot of meloxicam. Now, one note, this was a little bit different in experiment 1, just because we were looking at meloxicam as an intervention. So we withheld meloxicam for 2 days after our study treatment before the farm staff could treat them again. But other than that, the treatment protocol for diarrhea for the farm staff remained very similar between the 2 treatments. So following meloxicam, if the calf was also consuming less than 2 liters at 10 a.m. or less than 4 liters at 4 p.m., calves were assisted to the feeder to see if they would drink. If the calves went to the feeder and didn't drink from it, then the farm staff would offer them 2-liter bottle of milk replacer. Finally, if the calf refused this bottle of milk replacer and showed any sort of mild or moderate signs of dehydration, then we would offer them oral electrolytes. And finally, if any calves had really severe dehydration, they were treated by the herd veterinarian. And one thing with our dairy center that's maybe a little bit different than on regular dairy farms is that we do have our vet school there. So there were vets there learning, vet students there learning every day. So we did have a high access to veterinarians. So going on to our alert. So again, the idea was to provide these interventions at the time of the alert. So the alert we used was a reduction, a 40% reduction or more in milk intake or drinking speed over 2 days. And so to kind of give you a little idea about that, that's like a calf drinking 10 liters and dropping to 6 liters overnight. And then at the time of this alert, we would then intervene with our treatments. So the first experiment I'm going to cover is the meloxicam intervention study. And so here at the time of the alert, we just gave them either one subcutaneous injection of meloxicam or their control, which was just a saline. And also that was just one subcutaneous injection of that. So going into some of the diarrhea severity results. So overall, we had 71 calves within the study, so about 35 calves per treatment. And these calves triggered the alert around 9 days of age, and they were also diagnosed with diarrhea around the same time, about 9 days of age as well. And there was no difference in this between study treatment. So we also didn't find any differences in diarrhea duration between the 2 study treatments. So on average, the calves had diarrhea for around 3 days of age. And we also found no difference in dehydration or attitude scores between the treatments or any growth differences as well. But interestingly, we did find that the NSAID calves were less likely to receive electrolytes compared to the colostrum calves. So over here, I have a graph looking at sort of their predicted probability or the chance of these animals receiving electrolytes. And as you can see, calves that received an NSAID had only about less than 20% chance of receiving electrolytes versus the control calves, which had about a 40% chance of receiving electrolytes. We also didn't find any differences in milk intake between the study treatments, but I did want to note that numerically, sort of the day of and the day after the treatment was given, the NSAID calves did consume 1 liter of milk per day more than the control calves. But again, considering that an NSAID really only lasts about 48 hours, this result kind of makes sense. But one interesting result that we found is that the NSAID calves had reduced lying time and increased activity compared to control calves over the 5 days after the alert. And again, as you can see here, this was really driven for the lying time on the day of the alert and the day after when they received the treatment, where they were significantly lying less than the control calves. And then overall, they had more activity. And again, going back to our sickness behaviors, I mean, increased lying time and reduced activity could be, well, is considered sort of a sign of sickness. So a reduction in lying time and an increase in activity to us shows that these calves were displaying less sickness behaviors. So overall from the study, even though the NSAID didn't really influence diarrhea severity, milk intake, or growth, we did see that it did reduce the number of electrolyte treatments that these calves, NSAID calves, need to receive, as well as improved activity behaviors related to sickness. So we'll move on into the second study, which was looking at colostrum supplementation. So again, after this disease alert was triggered, we would provide our treatments. So our first treatment was looking at colostrum replacer, and basically gave them just 1 liter bottle for 4 consecutive days in the pen. And then for our control, we just used the same milk replacer that they were receiving from the automated feeder, and we provided that in a bottle as well and just fed it to them in the pen for 4 consecutive days. So going over the diarrhea severity results for experiment 2. So in total, we had 88 calves within this experiment, so about 44 calves for each treatment. And very similar to our first study, we found that these calves triggered the alert around 10 days of age and were diagnosed with diarrhea around the same time, 10 days of age as well. And again, no difference in that between study treatments. Surprisingly, we didn't find any differences in diarrhea duration between study treatments. It was very similar to our first study where, on average, calves had about 3 days of diarrhea. Previous studies sort of looking at colostrum supplementation to help with diarrhea have found differences in diarrhea duration. So potentially one difference with our study compared to other studies is that I would say 3 days of diarrhea is a pretty mild bout of diarrhea versus some of these other studies looking at colostrum supplementation to help with diarrhea. They had more severe cases. So that's potentially why we didn't see any differences here. We also found no differences in dehydration or attitude scored between treatments, but we did find a lot of differences in what the farm staff treated the calves with. So overall, the colostrum calves were less likely to receive meloxicam, electrolytes, as well as additional supplementation, milk supplementation, than the milk replacer calves. So again, sort of looking at our predicted probability or chance of these animals getting these treatments, we can see here the chance of a colostrum calf getting meloxicam was about, I think, like 10% versus 35% for milk replacer calves. Interestingly, there was no differences in calves needing to be assisted up to the feeder, which kind of makes sense. Our alert was based on reductions in milk intake, and if the farm staff did see reductions in milk intake, then they would assist them to the feeder. But what was interesting was that we found that colostrum calves had a lower chance of getting additional milk bottle after being assisted to the feeder versus milk replacer calves, which to me means that when the farm staff brought up these calves to the milk feeder, the colostrum calves are more willing to drink the milk from the feeder versus the milk replacer calves weren't. And so then they were offered an additional bottle of milk replacer from the farm staff. And then we also found that there was some differences in electrolyte treatments. So the chance of a colostrum calf getting electrolytes was only 2% versus 15% for milk replacer calves. We also found some differences in growth. So colostrum calves gained about 0.1 kilograms per day more than the milk replacer calves, and this was maintained over the 14 days after the alert, which at 14 days after the alert, we can see that the colostrum calves weighed about 3 kilograms more than the milk replacer calves. And this, we think, was mostly due to increases in milk intake. So our colostrum calves consumed on average 1 liter per day more milk than milk replacer calves over the 14 days following the alert. And again, we can kind of see here right after the alert when they received the treatment, those 4 days, there's actually very little difference between the two treatments, but it seemed that these colostrum calves were able to recover faster and then able to increase their milk intake just quicker than the milk replacer calves after their diarrhea bout. And we saw similar results in their lying time and their activity. So overall, colostrum calves spent less time lying and were more active than milk replacer calves over the 14 days following the alert. And so again, if we kind of look at our lying time graph, we can see just after the alert, it was quite similar, but as these calves recover and later in the 2 weeks following, the colostrum calves had lower lying time compared to the milk replacer calves. And a similar trend was seen in the step count as well, which was our measure for activity. Again, right after the alert, it was quite similar between the treatments, but really the days following after they were recovered from it, their activity was a lot greater. And so overall, even though the colostrum supplementation didn't influence the duration of diarrhea or signs of dehydration and depressed attitude, it really did have a significant impact on how much the farm staff treated them with other therapies. And it also improved their milk intake, activity, and weight gain, suggesting that these colostrum calves had greater recovery from diarrhea compared to our control milk replacer calves. So to kind of have some take-home messages, I would say there was sort of two aspects to this to these studies. So the first aspect was really looking at different ways or different therapies we could provide these calves. And so again, providing meloxicam, I would say reduced pain or feelings of malaise or lethargy in these NSAID calves, as we saw that these calves had increased activity, reduced lying time, as well as received less electrolytes. Whereas the colostrum supplementation seemed to improve more of the recovery from diarrhea, as we saw these colostrum calves had improved milk intake, growth, activity behaviors, and received less treatments from farm staff. But the other aspect of the study was sort of looking at how we could use, or more like a proof of concept, to show that we could use these sort of disease alerts to detect the early onset of diarrhea, as well as make decision management decisions. So overall, I would say alert systems can be a useful tool for identifying diarrhea calves and may help with making decisions around treatments for these animals. But there were some limitations to the study, and one big limitation I would say is that although our diarrhea alert that was created showed really good diagnostic accuracy when it was created, when we kind of went and used it within our studies, the diagnostic accuracy was reduced, basically saying that it's really not, didn't really translate well to broader populations. So overall, like, the diarrhea alert still needs improvement, and future research needs to go into modifying these. So with that, I would like to thank everyone for listening to my presentation, and I will take any questions.
Wonderful. Thank you so much, Allison. That was a wonderful presentation. We do have 4 questions here in the chat. So the first one here is, what kind of technology can be used to help monitor the calves? So maybe just a little bit more detail on what that might be.
Yeah, I think the main technology that we have now is automated milk feeders. And so again, this is typically used for like group housing systems. So this really tracks like their milk intakes and drinking speeds, which have been shown to be really important in detecting diarrhea. But I think one technology that is underutilized in calves is actually activity monitors. And we're currently looking at creating an alert that sort of encompasses all these. Their activity really decreases a lot when they get diarrhea. So hopefully in the future, we'll get good activity monitors put on calves that kind of connect with our automated milking systems or feeding systems. Yeah.
That's awesome. Thank you. Very cool. And the next one here we have is from Christine Oldfield. Is it safe to say that calves that were treated with exhibited fewer symptoms of illness?
I think from our study, I don't think it is safe to say that. I think we didn't really see any differences in their duration, how long they had diarrhea, as well as their other signs of dehydration and attitude scores. I guess you can say that for the meloxicam calves, I do think it did help reduce sort of those feelings of pain that can come with the diarrhea. I mean, it is sort of, well, we've all had diarrhea. We know that it can be quite uncomfortable. So yeah. And then in terms of the colostrum, I really do think it's more helping with the recovery of the disease Again, we don't really know what's in the colostrum that's sort of helping this, but we do believe that it helps with the recovery of the gut. And so that's able for them to sort of just get back on their feet faster.
For sure, for sure. Thank you. And we have another one here. Would you take different approaches for different dairy breeds?
Yeah, that's a great question. To be honest, I don't think I would. I think these are pretty standard treatments for cattle. So, yeah.
So, just a couple more here. If you were to ask a youth to solve a problem related to this topic, what would that problem be?
If you were to ask youth, yeah, that's an interesting question.
Yeah, I'm trying to think if we were let's think if we were a dairy cow club, a 4-H dairy calf club. What kind of problem do you think that they would solve related to this, or maybe think about?
Yeah, I think, yeah, that's a problem related to this disease.
Maybe around treatment.
Yeah, I was going to say, like, I think identifying, like, kind of going onto your farm, like thinking of something they could do on their farm is sort of how can you improve sort of like monitoring these behaviors on your farm to help you make more better, help you improve detection, I guess, of the diarrhea. So whether that could be, yeah, looking at their milk intakes, which I think you can monitor both individually and in a group setting with or without automated feeders, water intakes and that kind of stuff. So kind of just like, what sort of behaviors do you see on your farm and how can you incorporate that into your disease detection?
Awesome. Thank you. And just the last one here, if they were more active and spent less time lying down, would that mean that they were feeling less poorly?
Yes, that was sort of our interpretation of that. Again, like a really common sign of sickness is, yeah, just feeling more tired, spending more time lying, and not playing as much as either with other calves. And so when you see them lying down less, and especially with like step count, that's not necessarily the amount of time they're spending standing. It's more of amount of time they're actually moving around. Definitely shows that they likely were probably interacting with the environment more, playing more, and that type of stuff, which would suggest that they were feeling better than the other calves on the control treatments.
Awesome. Well, thank you, Allison. That looks like all the questions we have in the chat so far. If there's anything else that comes back up, we'll bring you and Kristen both back up after Kristen's presentation to answer. But thank you so much, and we will toss it over to Kristen.
Which, if you'll just bear with me a moment, I will pull it up here. There we go. Let me get it playing there. Okay, so yeah, thank you again. My name is Kristen Edwards, and today I will share my research with you as it relates to evaluating bovine colostrum replacer supplementation to improve the weaning transition in Holstein dairy calves. So I'm sure, as many of you know, weaning is a really critical time in a calf's life, and it involves the transition from a liquid diet, which is either milk or milk replacer, to a solid diet. And during this time, there are really considerable modifications that are happening to that gastrointestinal tract because both the primary location for digestion as well as the energy source is changing during this time. And so unfortunately, dairy calves often fail to eat enough solid feed before they are fully weaned. And that comes with a lot of consequences. So one of which is increased leaky gut, or the scientific word is increased intestinal permeability. So of course, we want our intestines to essentially have a fairly solid barrier. Of course, certainly some things pass, but it's the things we want to pass. And when we have increased leaky gut, we end up having some spaces opening up, and then bacteria and other substances that we don't necessarily want to leave the intestine are able to make their way into the bloodstream. So that is not a good thing. The other thing that we see in these dairy calves is that there's actually reduced immune function of that gastrointestinal tract, as well as changes to the villi and crypts of the intestine. So in the intestine, there are these finger-like projections, which we refer to as the villi, and the crypts are sort of the valleys. And so we see changes to that in the intestine as well. And unfortunately, as a result of these stressors, these dairy calves often experience reduced weight gain during weaning, as well as increased illness. And specifically, we tend to see a lot of respiratory disease, in other words, pneumonia. Now, when it comes to this decreased gain, that does actually have long-term implications. So it's been demonstrated that for every additional 100 grams per day of average daily gain from weaning until breeding, that there's an associated 820 kilos of extra milk across the first 3 lactations. So having this reduced gain in that peri-weaning period does have long-term implications. And so if we could perhaps support the transition during weaning, so from liquid to solid feed, then hopefully we could also potentially not only reduce illness, but also improve average daily gain to positively impact future productivity. And so that kind of got me thinking, and this is kind of a nice, a reason I said it was a nice segue from Allison's presentation, because I was wondering, maybe if we supplemented bovine colostrum replacer during weaning, maybe we could assist that transition. And the reason that I wondered if it could be beneficial is because colostrum contains really a myriad of bioactive molecules. It's not just those IgGs that are giving the calf a lot of its immune system that we're feeding on the first day of life, but it also includes growth factors and antioxidants and a lot of different substances that can influence a lot of the physiological pathways in the calf. So the immune pathways, metabolic pathways, as well as endocrine pathways. And what's interesting is that when we look at research on the swine side, this has actually been fed to weanling piglets. So when weanling piglets are fed supplemented bovine colostrum replacer, it's been shown that they have increased villus height of the intestine. So again, those finger-like projections on the intestine. They have reduced leaky gut. And they also have improved feed intake, improved weight gain, as well as an improved feed to gain ratio. So if in weanling piglets, supplementation of bovine colostrum replacer was able to help reduce some of the negative effects of weaning, is that something that could be applied to our dairy calves as well? And so the study that I will share with you has been published in the Journal of Dairy Science along with some other colleagues here at the University of Guelph. And so what we did for this study was we actually conducted this on a commercial dairy farm in southwestern Ontario. So it wasn't done at the university, it was actually done at one of Tavistock Veterinarian's clients. And so we enrolled 65 female Holstein dairy calves, and each of these calves were housed individually from birth all the way to 70 days. And they were fed milk 3 times daily, and they were allowed to drink up to 12 liters per day. Now, they were weaned over 8 days, which is a fairly short weaning period, but nonetheless, they were weaned from day 57 until 64. And then what we did at that time, prior to weaning, was we blocked them by birth weight, and we enrolled them into one of 2 treatments, which were equal in metabolizable energy, so in other words, calories, and the treatment was fed once daily during weaning, so once a day over those 8 days. So we had our control group who during that treatment feeding just received a a control, and it was just shy of 4 liters of their regular milk replacer, which was at 150 grams per liter concentration. So very typical concentration that calves receive. And then we had our colostrum group. And so they actually received a mixture of the milk replacer and the colostrum. So it was essentially just shy of 1 liter of the colostrum replacer. And again, as you'll remember, I said we wanted, we made the treatments equal in calories. So since colostrum is more calorically dense, their concentration that we included of that was at 125 grams per liter instead of 150 grams per liter. And then we mixed it with just shy of 3 liters of their milk replacer at the same 150 gram per liter concentration. And so I'll just walk you through this experimental timeline because it's a little bit complicated and we measured a lot of things. So when the calf was born, we got a body weight on them using an electronic scale. And then at 2 days of age, we bled these calves to assess their serum total proteins as well as their serum IgGs. So to essentially assess how that colostrum was absorbed in them. And then starting at day 50, which was 1 week prior to weaning, we started measuring starter intake daily on these calves. And then because we were also interested in seeing if colostrum could reduce leaky gut, we assessed their intestinal permeability, aka their leaky gut, the day prior to weaning and then the day after weaning was completed. And we also respiratory scored these calves daily. So that's what that BRD scoring is. And we did that from 1 day prior to weaning all the way out to 1 week after weaning was completed. We also used ultrasound to scan the lungs of these calves to look for consolidation. And that's really helpful because we don't always see pneumonia, and some of it is what we refer to as subclinical, meaning those calves aren't showing clinical signs. So this was another way for us to identify if some calves did indeed have some subclinical pneumonia. So we did that on the day weaning began, the day weaning finished, and then 1 week after weaning was completed. And we also bled these calves at those same time points to assess their serum beta-hydroxybutyrate. And so the reason we did that is in addition to having these daily starter intakes, these serum BHBs can also provide an idea of how much starter is being consumed. And then we also fecal scored these calves. So that is an objective way to assess whether a calf has diarrhea or not. And so we did that daily from the onset of weaning all the way out to 1 week after weaning. And of course, we monitored for mortality as well as other illnesses. So no calves in our trial died, so we were able to follow all of them out. And then, we also monitored for any illnesses. And so as I mentioned, these calves were kept in their individual housing from birth until day 70. And then at that point was when they entered group housing. So each of the groups consisted of about 10 to 12 calves, and each group was a mixture of both our control calves as well as our colostrum calves. And we followed all of our calves all the way out to day 84. And I think must have missed it here, but anyway, we also, in addition to getting our birth body weights, we also got our body weights at the onset of weaning, so day 57, halfway through at day 60, day 64, and then we did it as well at day 70, 77, and 84. So essentially every week for 3 weeks after weaning was completed. And so I will share the results of this study. So we were not able to detect any differences between our control and our colostrum calves in terms of intestinal permeability, so no difference in leaky gut. We also were not able to detect any differences between those two groups as far as lung consolidation or the respiratory score went. There was no difference in fecal consistency. And we also had no difference in morbidity. So in other words, no difference in illness between the groups. We also were not able to detect any differences in starter intake. But the story doesn't end there. And what's really interesting is that although we weren't able to detect any differences in any of those other variables that we looked at, we were able to detect differences in terms of growth. So at day 77 and day 84, which was 2 and 3 weeks after weaning was completed, and also 1 and 2 weeks after those calves entered group housing, the calves that received the colostrum were almost 3 kilos heavier. So at day 77, they were 2.79 kilos heavier than the control calves. And at day 84, they were 2.76 kilos heavier than those control calves. And so, of course, no study is perfect. I think it's always important to identify what the limitations are. So, of course, in our study, as I mentioned at the beginning, it was conducted over a fairly short weaning period. So it was fairly short and abrupt. So it's possible that these benefits may not be observed in herds that are weaning their calves gradually and in a stepwise manner. But that being said, there are still a meaningful number of farms around the world that do practice this short and abrupt weaning, which is, of course, not ideal. As well, I mentioned that we controlled for metabolizable energy. So you kind of have to choose what you're going to control for, and you can't really control for all aspects of nutrition, which means we didn't control for the fat or protein. But that being said, in other studies that have manipulated fat or protein and assessed weight gain, when differences are detected, it's usually detected during the feeding period, whereas we found our differences 2 and 3 weeks after the feeding period had finished. As well, although I have some ideas for why these colostrum calves were heavier 2 and 3 weeks after weaning was completed, we don't really know the mechanism of action because we weren't able to demonstrate that there was a change in leaky gut. And then lastly, because this really was the first study of its kind, looking at using colostrum to help the weaning transition, we don't know what the optimal dose is. So the dose we went in at, we could potentially go lower and still see those benefits. So we don't really know what the optimal dose is. And so I'll just leave you with some takeaways from this presentation. So even though I mentioned it was the first of its kind, and certainly it would be good to see more studies evaluating bovine colostrum replacer at the time of weaning, we were able to demonstrate that there was an associated improvement in weight gain. And so I think that there is a real opportunity to use bovine colostrum replacer as a tool to help improve the weaning transition. And so I'd like to thank you for your time and listening and joining in. And yeah, with that, I'll take any questions.
Thank you so much, Kristen. That was a great presentation. I'm actually going to start by jumping back to one of the questions that came up earlier, but would you take a different approach to this study for different dairy breeds?
No, I wouldn't. And I think because regardless of the dairy breed, you're going to see those same stressors and those same effects. So what I would potentially be more interested in terms of the dairy breeds is maybe the efficacious dose of colostrum is perhaps different between the breeds.
Right, fair. And if you were to, we'll maybe jump to that other one that came up regarding the problem solving. So if you were to ask a youth to solve a problem related to this topic, what would that problem be?
Yeah, so that's a great question. So what I would ask a youth to look at is, especially around the weaning period, looking at just after weaning is completed, how many calves are getting sick with either diarrhea or respiratory disease. And if you're seeing a really big jump, then I think that's a nice indication that there's opportunity to improve how calves are being weaned, and then really investigate the way calves are being weaned, not only in terms of how milk is being reduced, But when are calves being moved? What other potentially stressful events like dehorning might be happening around there? I think that's a really nice way to investigate problems around weaning.
Awesome. Thank you. And we just have a few more questions here that are coming through. Do you think that milk replacer would cause weight gain same as colostrum?
Yeah, good question. So I don't think so. Again, because we controlled for energy, it's not that there was more energy. What I think is happening is because of those bioactive molecules that are in colostrum, which I think is really unique to colostrum, and we don't see that in milk replacer. I think what we're seeing is an increase in those villi, so those finger-like projections on the intestine. So that was also seen in piglets. And I think the reason we're seeing that gain is because by increasing the height of these finger-like projections, you have a larger surface area to absorb nutrients. And I think that is potentially one of the reasons why we're seeing increased gain. And the way to figure that out would essentially be to sacrifice a couple animals at the end of the study, which we didn't, and then look at their intestinal morphology, really.
Awesome. Thank you. And how can 4-H dairy volunteers incorporate this information into their clubs?
Yeah, so I think some of the really important information around this is really just about weaning as a stressful time and investigating the disease that may or may not be happening around weaning, and really assessing how weaning is being conducted. And so, we want to do it in a gradual, stepwise manner, but there are some farms that still really want to do it fairly cold turkey. And so for those farms that don't want to adjust their weaning protocols, I think looking at other ways that we can support calves, potentially through supplementing colostrum, is a way that you could incorporate that information into clubs.
Awesome. Thank you. And this question is directed to the both of you. So maybe, Kristen, you can start. Could you talk about how you got on the career path that you are?
Yeah. So, I mean, I guess I have a bit of an unconventional career path story. So I'm from Toronto, obviously not a lot of farms in Toronto. And when I came to the University of Guelph, I knew I wanted to be a vet, and I got experience in everything. I mean, cats, dogs, horses, chickens. And then finally, when I got over to cows, I was like, oh, this is it. So then I started working on farms, got into vet school, graduated vet school, and I've been a dairy vet for over 11 years now. And wanting to give back to the industry in a broader way, I really wanted to get into research. So I just wrapped up my PhD in February, and now I'm on faculty at the Ontario Veterinary College.
Awesome. Thank you. And Allison, how about yourself?
Yeah, as you mentioned in my bio, like I did grow up on a pig farm, and actually one of the first jobs I got was working on a dairy farm. So I kind of worked through all through high school, milking cows, and even after my undergraduate degree. And I don't know, I think after my undergraduate degree working on dairy farms, you really come to realize that it is a science. Farming is a science, and I just got really interested in how can we, better manage cattle. And so that made me go on to do my master's at the University of British Columbia with the animal welfare program. And I kind of looked at different weaning management strategies there. And then coming here to Guelph to do my PhD, which sort of focused on calf health and automated technology.
Awesome. Very cool. Well, that looks like that's it for the questions so far, but please feel free to those who are watching to add your questions in, and we'll be sure to connect with Kristen and Allison, and they can answer those for you. Thank you so much for those insightful presentations today. I know I learned a lot, and I'm sure all of our 4-H volunteers, youth, and others watching did as well. So thank you so much. And again, drop your questions in the comment section if you have them. Thank you.